Hi, my name is Haitian Jonas Belazier. We have Stephanie Gary with us today, represent Partners in Health. And Stephanie, tell the people who you are a little bit, and welcome to HaitianJonas.com.
Thanks very much. I actually moved here to Boston about 3 months ago from Haiti. I was living in Port-au-Prince. I work with Partners in Health on the communications team, and we're really excited to be here today working together with the Haitian community to raise funds to help Haiti build back better after the earthquake.
According to Juanito's song, a lot of people are going to learn Creole, so you must speak Creole.
Oui, me parle Creole, yon ti cras.
It's amazing. Stephanie, we have the great soccer event today, Haiti versus Harvard. What is this for you today? What is it?
Well, today is really a great moment to bring the Haitian community here in Boston together with all the people in America who care about Haiti and want to help Haiti recover after the earthquake, and to raise funds for Partners in Health. Partners in Health has quite honestly been one of the few organizations to have a lot of progress after the earthquake. We are about to inaugurate a 320-bed national teaching hospital in Mirebalais, just 30 miles from Port-au-Prince, where Haitian medical students can learn how to give quality health care and where Haitians can go to get top healthcare services.
For me, this is important. When I see Haitian, when they're sick, most of the time they carry them with somebody and bring them to a hospital, and they have to pay for it, and then when they get, it's so difficult for them to get to the hospital. Where is Partners in Health is going with this?
Well, that's a great question. Partners in Health believes that charging people for healthcare is a huge barrier to most people in poor countries to healthcare, and that's why we do not charge fees to people who come to our clinics for healthcare.
Did you hear that? They do not charge fee. So there are not a lot of Haitians here today who are supposed to be in that contribution. What can you tell them next time when we have an event like that? What can you tell them to come and be part of that Partners in Health Foundation?
Well, that's exactly right. Because we don't charge fees, we need other ways to gain income to provide those healthcare services. So we really need your support. The work in Haiti is not over. We continue to need people's support, including Haitians living in the United States, to help us create something really, truly remarkable in the aftermath of the earthquake.
I know, like Harvard, they usually have like at Harvard University, any university you're going, and any hospital you're going, they have a funding. There's a place that you can submit and send money and continue to donate. Does Harvard, Partners in Health have that kind of foundation link that people can go to and do a donation as like monthly, just to help young Haitian?
Yes, absolutely, and we would greatly appreciate if you would do that. Our website is www.pih.org for Partners in Health, and you can make a donation there. You can make a monthly donation, and we greatly appreciate all your support, and all your contributions are tax deductible.
Beautiful. Stephanie, it's a blessing. It's a great opportunity for me to speak to you on behalf, the whole Haitian, population in Boston, New York, Miami, Chicago, everywhere. I just want to say thank you. Anything you want to say to the Boston people?
Kembe Fem.
I like it.
You, ma'am.
Thank you so much, Stephanie.
The first walls that are going up are in the Women's Outpatient Center. We'll also have 3 wards that are just dedicated to women's inpatient care, in addition to several ORs that are going to be doing just GYN-related surgery. The earthquake was tragic, but we have a new opening and a new opportunity to do things very, very differently. And we're starting right here in Mirebalais, which is a clean slate. And when you think about research, service, and training, the 3 things that we link very heavily, we are using this as an opportunity to, from day one, kind of have those intertwined. Specifically around medical education and nursing education. We're building this hospital to accommodate teaching rounds. None of our other hospitals can really do that. We're building this hospital, the second floor of our hospital, to have seminar rooms with high-speed internet for our students here, Haitian medical students and nurses, to be able to upload a video and watch a video from a lecture at Harvard Medical School right here in rural Haiti. As Partners in Health expanded in the Central Plateau, La Colline, Bougankare, Kanj was already there, Belader, the people, the denizens of Mirebalais, felt that in order to get quality care, they had to go outside of their own city. So in November of 2008, we officially were asked by the Ministry of Health to fill the void, and we responded in kind. We're going to have modern sterilization facilities for our 6 operating rooms, 6 being the most operating rooms in a public facility in the country. We're going to have digital radiography, again, not available in the public sector, but doing it in a way that is responsible insofar as making sure we can maintain what we're doing. And that's always, we have to walk a fine line, because we can't put systems in place that are incredibly novel in terms of a technology point of view that in 3 months then break down and we can't service them. The cholera treatment center prior to cholera was a barren hill behind the hospital that essentially collected a lot of garbage.
Nous gagnons 3 solutions que nous faisons ensemble avec lui. Première solution, c'est 001. Les mêmes nous servent ensemble avec lui pour nous laver mes nous. Et nous gagnons c'est 02. Il y a fait nous lever pieds nous, pour capable de pieds nous.
Because the Central Plateau is one of the epicenters of the outbreak, we were seeing hundreds and hundreds of people per day, so we needed to act quickly. Right now we're in an epidemic phase of cholera in Haiti. It usually follows a predictable course of becoming endemic. Therefore, we expect cholera to be here for a long, long time. So we're going to have to think critically about a permanent structure or a semi-permanent structure that's not a tent camp, but real infrastructure to accommodate our cholera patients. But it's such a contagious disease that we really have to isolate those patients, and they can't even really be seen in the hospital, or else we risk contaminating people who come in with medical conditions that aren't cholera.
Et si on machine vient ensemble avec un choléra, c'est avec solution 02 ça, nous prenons nous fait tout arrangement possible, nous désinfecter machine et pour machine capable aller sans choléra là-dedans.
We have grown, and through our growth and through our experience are now ready and primed to responsibly and adequately build.
Moi, c'est Nadège Morette. Moi, je suis Belader. Moi, j'ai 27 ans. Pour mon bébé dans votre main? Ok. Pour faire l'opération. C'est normal, moi, j'ai fait l'opération déjà. Ça va déranger. Belader, pas de gynécologue en attendant pour le moment ça. C'est parce que le docteur Emilien, c'est un spécialiste dans le domaine.
I'm Dr. Emilien Christophe in OB/GYN. I like this because it's my specialty. I like to do C-section. Since 2008 until now, I'm the medical director of Las Caobas Hospital. When I came here, we don't have the operating room. To be honest, I want to talk to you about Dr. David and Dr. Paul.
My name is David Walton. I am a practicing physician working in Haiti, and I worked in Las Caobas from 2002 up until 2008.
I have a patient who died during the transport to Kanj. This patient had the placenta previa, and this placenta previa makes this patient bleeding. And the patient is bleeding, and the patient is bleeding so high, during the transport the patient was died. That was very dramatic situation. I used this situation to make advocacy, Dr. David, Dr. Paul, and I remember when Dr. Paul came here, he told me, what we can do.
That was a pivotal moment in which we knew that there was no other option. We had to do this. And so we reached out to some donors that had previously helped fund La Colline, and they made more donations so that we could put that operating room in place. You know, seconds matter, minutes matter, and that determines life or death for a woman who's delivering, who has a complication.
Et puis après, j'ai fait une opération déjà qui fait me faire césarienne. J'ai aidé nos Christelle Moi, j'ai 28 ans. Oui, si je suis accouché là, je suis un gros problème qui arrive. Je suis assurée. C'est grâce à eux-mêmes parfois qui fait qu'il y a une femme qui va mourir.
Our ability to put that operating room in there, and again, operating room is probably a strong term. It's really a procedure room. Has truly saved lives. But of course, Milien is the architect of that initiative. Women's health is such a critical component of what we do. We wanted to do, and eventually did, is create the second freestanding women's clinic in central Haiti. We truly encourage more and more women to deliver at Las Caobas. We've been successful, and our success is measured by deliveries per month.
In 2008, the number was about 18 deliveries a month, and after we have about 120, 110 deliveries.
But again, there's ebbs and flows, and sometimes it's truly overwhelming, and it's difficult to keep up.
Il y a une infirmière sage-femme, il y a une infirmière circulante, il y a un obstétricien gynécologue et un anesthésiste. Il appelle Natacha, infirmière sage-femme, à cause de tremblement de terre qui était passé en 2010. Ça a fait qu'il y a plus de monde qui était habité dans la zone de Las Caobas, il y a plus de présentation. Ça a toujours été même quantité, mais on a toujours venu plus dans l'hôpital.
But I think the Miembare team will be very helpful. The Miembare Hospital they build now will be very